Hello, everyone, and welcome to my poster presentation for the APA meeting for 2020. The title of my presentation is Pancreatic Ductal Adenocarcinoma Screening in High-Risk Individuals, a Single Academic Center Experience. Pancreatic ductal adenocarcinoma is a lethal disease with no population screening strategy. Screening in high-risk individuals may be justified. However, current consensus is based on evidence of increased risk and impact of screening on patient outcome, and early detection remains unclear. More data are needed to guide further innovation and further practice. We aimed to study the Mayo Clinic experience with pancreatic ductal adenocarcinoma screening in high-risk individuals. This is a single-center retrospective cohort study of high-risk individuals evaluated in the Pancreas Clinic between 2010 to 2019. Subjects were identified based on a predefined inclusion criteria, and all those who presented with pancreatic ductal adenocarcinoma at index visit were excluded. Records were reviewed to identify demographic, clinical, imaging, and pathology data for high-risk individuals who participated with at least one screening examination. Chi-square test was used for comparative inferences between groups. 76 patients met high-risk inclusion criteria with a mean follow-up duration of 3 years. High-risk individual groups included familial pancreatic ductal adenocarcinoma kindreds, germline mutations carriers, and hereditary pancreatitis. Majority of patients were females of about 72.4%, non-smokers of 68.4%, and the prevalence of diabetes was 9.2%. 59 patients underwent screening, and abdominal MRI was the most frequent index screening modality compared to CT and EUS by 40.8%. At index screening, 49.2% had abnormal pancreatic imaging findings, and the majority of which were pancreatic cysts by about 30.5%. Only 13.2% developed significant changes between the index and the terminal screening examination. Compliance with ongoing screening was significantly higher in patients with an abnormal index examination by 83% compared to 60%. 3 high-risk individuals underwent pancreatic surgery. None were found to have high-grade dysplasia or pancreatic ductal adenocarcinoma. We concluded that the majority of incidental pancreatic findings identified at index imaging in high-risk individuals do not change significantly on interval imaging, and the compliance with follow-up imaging is significantly higher in those with an abnormal index examination. Thank you.